And then we can cut out all the, oh, there we go.
Oh, okay. Hi, everybody. I'm Dr. Grace Hula, and I am happy to present today's talk. We're going to talk about gut-brain axis. And before I start, I'd just like to welcome everybody. Suzana Pavlovic, who is going to be my co-presenter, and Dr. C is in the house, Zorika, Sal, and Gail. You're all most welcome. These are my support team, and I'm going to kick off by asking a few questions. When you think about your health, people, what are your biggest health challenges? What is the number one challenge you're trying to achieve? What's the number one health challenge that you have in your life? What do you need help with your health? Yes, I can see sugar cravings. That is a common one. To live longer, good. You know, when you type in and respond and it's interactive, you tend to retain more. So I always encourage interaction during my talks. Please send messages in the chat, say yes, say whatever questions or you have, post them in the chat. So what are you trying to achieve, or what will you achieve from today's masterclass? So those are thoughts for you, things to think about. Okay, as you know, my background, I diagnosed myself with diabetes. I was a busy doctor working on a busy diabetic ward. And since then, I took metformin, a medication for type 2 diabetes, and managed over time to reverse my type 2 diabetes to remission status. I never say I completely cured it, because I know you have to be on the alert for the rest of your life if you have that gene, if you have the propensity, if you've been diabetic before. So I never sit still. I always look at my lifestyle. How am I doing with my nutrition? Am I keeping a low carb, healthy, whole food diet? Am I avoiding processed foods? Am I making sure I don't eat sugary stuff, drink pop drinks? So I've managed to eliminate a lot of the bad foods out of my diet. Okay, once in a while, at Christmas, birthdays, I might have a taste of something. But even now, because I've been off it for a long time, it never tastes the same. It doesn't taste good anymore. And thank goodness to this new product that I've got through Dr. C and Suzana, called the Feel Great System, which has Unimate and Balance. Honestly, it's been a game changer. It's made my intermittent fasting ridiculously easy, a no-brainer. You just wake up in the morning, have a hot drink, and boom, you don't feel hungry, you feel good, you feel great, full of energy, no brain fog, clear-headed. So I cannot thank them enough. Okay, so bearing all that in mind, I am going to kick off by saying, what is functional medicine? That's the main thing that I do. So my background, I'm a family physician or a GP, but I specialize in functional medicine. Functional medicine is root cause medicine. This is a branch of medicine that is still very new. We are not taught it in medical school, but some of us who've had life challenges and some of us who have seen patients not get better year after year of giving them pharmaceutical medications, they come back with side effects. They never get better. We started to question ourselves and say, are we really doing what we were meant to do? Are we healing patients or are we harming patients? And then one day I landed on a podcast that was a functional medicine podcast, and things clicked. And I was like, yeah, this is where I need to be. If we can reverse conditions and get people off medication, this is where I want to be. This is the job I want to do. So I went back and trained for 3 years as a functional medicine practitioner, root cause practitioner, looking for the reasons why people fall ill in the first place. And that's why I am here today. So as a catalyst in the transformation of healthcare, functional medicine treats the root causes of diseases and restores healthy function through a personalized patient experience. So my background, as I said, general practitioner, functional medicine, PhD in neuroscience, member of Royal College of General Practitioners, member of British College of Aesthetic Medicine, and I am based in the UK, in Sheffield, but I have clinics at Harley Street in London, Birmingham, Manchester, and Liverpool. I believe everyone has the potential to achieve optimal health, and I'm dedicated to help people achieve their goals. So what's the difference between conventional medicine and root cause medicine? So in conventional medicine, it's mainly disease-oriented, doctor-centered. The doctor tells you, do this, do that. You have symptoms, this is a medication you should take, and everyone is treated with the same type of medication. And their diagnosis is based on symptoms. Functional medicine is health-oriented, patient-centered, holistic. So we have time. There's no limit of 15, 10-minute appointments. We have time, we can spend an hour or 2 hours, patients feel listened to, and we look at patient's background from birth, from pregnancy, when the mom was pregnant, all through life, any traumatic events, significant events are all looked at. It's a holistic approach. We look at your sleep, we look at your stress, and we do cutting-edge scientific tests which tell us what is happening at a scientific level. So there's a big preventative element and a big reversal approach. So it's mainly great for managing chronic diseases. And these are just a few of the diseases that you can manage with root cause medicine. Chronic fatigue, fibromyalgia, chronic pain, type 2 diabetes, high blood pressure, irritable bowel, ulcerative colitis, Crohn's, arthritis, menopause, andropause, autoimmune conditions, memory problems, ADHD. So these are just to mention a few. And then the tests we do are very comprehensive, stool analysis to check gut health. Gut health is big, and as you will see later on, most things start at the level of the gut. And if you can correct the gut, you can correct a lot of medical conditions. We do epigenetics to check what DNA you've inherited and how we can modulate that. We check your organic urine tests to see your amino acid levels, your vitamin levels, neurotransmitters, energy, oxidative stress, and detoxification. And then we do a full hormone profile for both men and women, checking all your hormones, including cortisol levels. So this is one slide showing the different tests and how they look. The first one, I'll pinch, is the gut test. You can see where you have the green, the yellow, and the pink. The green are the good bacteria. We want them to be 3+ and above. NG means no growth. That is very bad. That means that person's gut is not working well and they have a gut dysbiosis. Yellow, we don't want yellow because those are useless bacteria that are doing nothing but taking space from the good bacteria and preventing them from growing. If you have anything in pink, then that's really bad because it means you have probably a leaky gut. And then we don't want any yeast or fungus, so we have to find ways of getting rid of those. Usually there's a sensitivity test which tells us which supplements to take. And in the next slide, that is an organic acid test showing you levels of different, in this case, detoxification markers. And you can see it correlates with the DNA test above. So this person has inherited a strong detoxification genes, so they're not detoxifying chemicals properly in the body. And as you can see, they have high levels of toxic elements, which indicate that they need help and support with detoxification. We can also tell pancreatic insufficiency, how your elastase level is, and how it's working. DNA test tells us, again, here in this case, it's the detoxification gene with 3 blue dots showing there's a deletion in the GSTM1 gene, which is responsible for detoxification. So liver clearance of waste products is poor in this person. If they don't get support, they will end up with fatty liver and several other conditions and bad gut health as well. So it goes on, and it will become more clear. The other one is showing you the hormone test. And this particular person has really high levels of estrogen. As you can see, the red dots are showing really high levels of estrogen. If this is left like this person will either end up with endometriosis, fibroids, or even cancer, endometrial cancer or breast cancer, because the hormones are way too high. So we can rebalance this by giving supplements or changing lifestyle. Healing the gut is usually a big one because estrogen and the gut are related. So this is just a snippet. So a quick example of some of the slides that you get from the complete stool analysis. This person, you can see, has parasites in their stool. You'll be surprised. These parasites are very smart. They hide in the stool. You will not see them. But if you, with knowledge, like I'm telling you now, if you just pat your stool, you would see worms in this particular sample, in their stool. But they wouldn't know because it would all be covered in the middle of the stool. And they're wondering, why am I always hungry? Why is my gut not working well? It's because you have parasites. And then in this particular case, the elastase, the pancreatic enzyme, which is necessary for digestion, is too low. It should ideally be above 200, ideally above 500. Their inflammatory markers are high and their immune system is compromised. So the things in pink are showing a bad sign. And I can tell you, everybody's result is totally different. Nobody is the same. So it's shocking that in conventional medicine, we are all treated the same way when our basic problems are different. So if you're giving the same two people the same medication when their problems are different, they're not going to respond. And this is just showing you examples of 2 different people and their stool samples and how it looks. Okay. And then this shows sensitivity. So when you do the stool test, if it's grown any bacteria in the pink zone, it tells you which supplements or which antibiotics to use. So you're then relatively confident that you can treat these people. This is the metabolic test, which is the organic acid test. And this test tells you your nutritional deficiencies. You can see these are 2 different people and their deficiencies are different. But what is striking is that they're both deficient in almost everything. Vitamin A, vitamin C, alpha lipoic acid, vitamin E, glutathione, all the Bs, anything in yellow and red is deficiency. In the first slide, the only thing they have is CoQ10, manganese, and zinc. And the rest, I would class those as deficiencies. So this person's gut is not working well. So they're eating food, they think they're eating well, but the food is not being absorbed. And the reason the food is not being absorbed is because the gut bacteria, the microbiome, the ones we saw, are out of order. Those are the soldiers that we have. There are trillions of them that live in our gut. If they're not working well, we're not able to digest food properly, we're not able to absorb food properly. And what's the end result? Deficiencies. You wonder why you're tired, you wonder why you have brain fog, you wonder why you have insulin resistance. It's because your gut is not working well. Here's the hormone test. I love this because it just breaks it down from what makes, like, testosterone, which starts with pregnenolone, and you go to DHEAS, which then makes testosterone, which then can break into estrogen. So there's an interrelationship between all the hormones. And again, everybody's result is different. In this particular case, when they first came to us, the estrogen level was really high. And after 3 months of looking at this and seeing which enzyme is not working well and which pathway of detoxification is not working well, we were able to reverse it within 3 months. And in the opposite slide, you can see estrogen levels are back to normal. They're in the green. They're not in the red anymore. So it is easy to reverse conditions. So this is a DNA result. I just wanted to point out that from the DNA test, you can actually tell your recommended diet. In this particular person, their recommended diet was to follow a Mediterranean style diet. Increase the intake of polysaccharate, unsaturated fat food sources like walnuts, flax seeds, and fatty fish. Increase protein intake, and gives you a rough idea how much as well. And it also tells you which micronutrients you require, what you're deficient in. It tells you your food intolerances, and for instance, lactose or gluten. So this one, check for gluten intolerance and eliminate gluten, limit caffeine. They're not lactose intolerant, but avoid salt and salty foods. So everybody has a personalized plan. And the weight management, control your sweet tooth, it tells you off, and it tells you also your exercise response for weight management. Follow an exercise program that reaches at least 20 MET hours per week. So 20 MET hours per week, there's a calculation for it that tells you roughly how many hours of exercise your body type needs. Mine was 24 hours a week, which meant I have to exercise at least 5-6 times a week. Minimum, preferably every day. That's my body type. 20 MET hours is probably exercise 3 to 4 times a week. So everybody's exercise demands are different. So also it recommends a power-based training program, strength training, speed and power training to help to optimize, to get the best results, and ensure sufficient rest between intensive sessions. Manage your risk of soft tissue injuries. Practice pre-rehabilitative and flexibility training, and support collagen health with nutrition. So it tells you literally everything. So there's no guesswork. Just take guesswork out of the equation. I'm now going to move on to the gut. This is how your digestive system looks. Just to remind you that your GI tract, which is your gastrointestinal tract, starts in your mouth. So don't forget, the mouth has its own microbiome, and we need to look after our mouths, good oral hygiene, and then we need to go down through the food gullet, which is called the esophagus, where you go to the stomach, which is in yellow, and from the stomach, you go to the small intestine, which is browny, kind of orangey, and then you go to the large intestine, which is kind of violet. And then you have the liver. With the liver, you have the gallbladder in green, and you have your pancreas. So you have a rough idea where your internal organs are placed. So I'm going to go straight to the brain's influence on metabolic health. I hope you can see, sorry, something has appeared on my screen that I don't like, but I don't know how to remove it. I'm never having luck with these screens. Right, so I'll expand this. So the brown big thing that looks like worms on it is the brain. So they've taken a section of the brain that contains your hypothalamus and your pituitary glands. So this is what's called the HPA axis, the hypothalamus pituitary axis. And this is what regulates your cortisol levels, your stress levels. And you can see message is coming from the gut to the brain, and then the brain is sending the message back down, back to the gut. So the hypothalamus produces CRH, which is cortisol releasing hormone. which then sends a message to the pituitary gland, which you can see there, down below, which then produces ACTH, which is another hormone that sends a message to your adrenal glands. Your adrenal glands are small organs or glands that are above the kidney. They produce cortisol. Cortisol goes and influences the immune cells in your gut. Okay, so you can see this beautiful purpley violet down here where it says epithelium. That's the lining of your gut. That's the lining of your gut, and we need it to be intact. And it's protecting everything inside your gut. Your immune cells, your microbiome, everything is protected by the gut lining. So everything is related. So when the immune cells get a message, not only the immune cells, even the lining of your gut is affected, which then affects the gut microbiota, which is inside, and they regulate this lining. Later on, I'll show you what happens when this lining is compromised. So the hypothalamus regulates your hunger and your energy balance. Disrupted signaling in the hypothalamus leads to overeating, obesity, and insulin resistance, because your ghrelins and your leptins are also regulated by the hypothalamus, the brain and the stomach, produced in the stomach, but regulated by the brain. So chronic stress activates the HPA axis. Elevated cortisol promotes fat accumulation. So elevated cortisol leads to elevated sugar in your blood. Elevated sugar in your blood stimulates insulin production. Insulin production then moves fat to accumulate into your fat cells. So that's no good, and it's usually visceral fat, which is in the wrong areas, is surrounding your internal organs like your heart, your liver, your intestines, and pressing on them. And in the long run, that becomes chronic disease. And this creates a vicious cycle of inflammation and metabolic dysfunction. So this is the lining of the gut, okay? So when this is compromised, you can see the gut has so many things. Mucus production, it needs fiber. It needs fiber to keep the lining of the gut intact. Supplies energy, defense, immune system, prevention of colonization by pathogens. So these bacteria are busy cleaning the gut, digesting food, helping with absorption. But when this lining is compromised, then it opens up, there's more space in the cells, in the lining of the cells. And when that happens, then you start to leak things, undigested foods, dead bacteria, toxins into the blood, goes to the liver, poisons the rest of the body and the surrounding cells, creates high levels of inflammation. High levels of inflammation over time creates autoimmune diseases or other chronic diseases, high blood pressure, high insulin. So the cycle is vicious. And unless you correct the situation with the gut, the problem remains. So again, this is just a summary of what the gut-brain axis does. It's a bidirectional communication system involving the gut and the brain. You have neural pathways through the vagus nerve, you have hormonal signaling, immune responses, and it plays a pivotal role in metabolic health. Insulin resistance is at the center of obesity, type 2 diabetes, and cardiovascular disease. Suzana is going to talk more about that later on, so I will leave that to her, but this is just a quick mention and to put a picture in your heads so that you know when they're talking about different topics, you know what they're talking about. Now we're going to talk about dysbiosis, which is an imbalance in your gut microbiome. So when there's an imbalance, so you have a lot of the bad bacteria and the ugly bacteria, and few of the good bacteria. So you get disrupted production of short chain fatty acids, These enhance insulin sensitivity and reduce inflammation. So if you reduce the production of that, you increase insulin sensitivity, you increase inflammation, eventually you open the lining of the gut, and then there is chaos. There's lipopolysaccharides produced, which also trigger low-grade inflammation, and these are key drivers of insulin resistance. So again, this is another diagram of your lining of your gut, showing a dysbiosis and showing open spaces and how the LPS moves through and sets cytokine release, which sets inflammatory responses, can lead to type 2 diabetes, type 1 diabetes, heart disease, all sorts of problems. So how do you break the cycle? You can break the cycle with lifestyle, nutrition, intermittent fasting. So if you give the body time to rest, then it will produce less insulin, give the time for the gut to heal, and other things to support things like probiotics, which are live strains of bacteria, prebiotics, which are high fibers, and these restore the gut microbiome. Dietary interventions, high fiber, polyphenol-rich foods, reduce ultra-processed foods, and what has high fiber, what has high polyphenol foods? The Feel-Great system, which contains Unimate and balance. Then you need to do mind-body practices to reduce stress. You can do mindfulness, yoga, meditation, do deep breathing consciously to just calm down and stimulate the parasympathetic system. Other things in the future that studies are still going on with fecal microbiota transplantation. I think by the time you get there, you're really going extreme. But in cases where things are already gone so bad, that's the future. You can also have pharmaceutical or natural supplements approach where you target signaling pathways like the GLP-1 receptor agonist, which the Feel-Great system using through Unimate stimulates very well. So you don't need to take manufactured medications which have side effects. You can just take the natural ones, which increase GLP receptor agonists by 70%. Okay, so just little hacks, just a summary of what the gut does, mental health, 90% of your serotonin, 70% of your dopamine is produced by the gut bacteria. Weight management, the gut microbiota can influence weight by affecting your metabolism and regulating your appetite. And again, this is through insulin resistance. Energy systems, again, influence energy by boosting mitochondrial activity. Skin conditions, your gut and your skin are related. So when your gut is not well, you have a propensity to get skin conditions, acne, eczema, psoriasis, rosacea, all those are conditions that relate to the gut. Digestive efficiency, good gut health ensures optimal nutrient absorption and digestion. So you saw the slides where people were deficient in nutrients. It's because the gut wasn't working well. And so they ended up with deficiencies in vitamins and minerals and high toxic levels as well. So your immune system, 70% again, is in the gut. So again, I cannot stress enough, how many times do you go for number 2? Because that is so important. We underestimate the importance of that. If you're constipated, your gut is not working well. Minimum, you need to go at least once a day. This is a rough guide telling you what stool type you should have. Don't laugh at it. People run away from it. Please check your stools. You should be type 3 or type 4. Type 1 and 2 are constipation. Type 5 to 6 are diarrhea. So if you're constantly outside type 3 and 4, you need to do something about it. Usually change your diet. And this is about stomach acidity. You need to have a pH in your stomach of 1 to 2. Anything else means your digestion is not going to work properly, because you need a low stomach acidity to digest food properly. Again, this is showing someone with rosacea, symptoms, bloating, gas, indigestion, heartburn, burping, nausea. This person would never connect their rosacea to these symptoms. So just a warning, you have skin problems, that's a sign you have a bad gut. These are some supplements that you can take, natural products that can help stabilize your gut. You have apple cider vinegar, lemon juice, which is acidic, ginger, which helps to heal the gut, amino acids, which repair the lining of your gut. And you can have some supplements as well, which you can add in, vitamin C or other amino acids that will help stabilize your gut. And you can drink this daily throughout the day as well. So remove gut toxins by having high fibers. Again, go back to balance, which is part of the Feel Great system. You take balance, which has 7 different highly purified fibers that will clear the gut toxins. So there are things you can do. This is what I do with the functional medicine program. These are the offers we have. If anyone wants to go on the program, they have to contact me. So Rika will post a form that they can fill in, and tomorrow we can have a consultation and we can talk tests and we can have a plan, have plenty of time to invest in your health. Invest time in your health. Nothing else matters in your life if your health is not working. Some of the packages include the Feel Great system. Anybody taking on a year's package will have the Feel Great system, full body MRI scan, any CBT therapy or EMDR therapy if required, IV sessions, stress management strategies, weekly meetings, concierge level support, regular follow-ups, personalized treatment plans, nutrition, supplements, lifestyle modifications, and of course the advanced testings as well. The third line is anyone who wants health inside and out. So they want internal health with functional medicine, but they also want aesthetic package. So anyone interested, please fill in a form and we will look into that. These are our contact details. I'm now going to hand over to Suzana. Let me see in the comments. Knowledge how to dodge sugar insulin spikes. Dorika has posted the form that you can fill in, but these are our contact details as well, either by email through the website or our phone numbers. And I would like to carry on the conversation. So please contact us if you have any health issues. And Suzana, I will hand over to you.
Thank you so much, Dr. Grace, and thank you for hosting and having me on. Hi, Sal, I see your message. It's nice to be on. Okay, so as Dr. Grace has mentioned, your gut and brain are in constant communications, and you learn something new all the time, and I never thought about it this way until Dr. Grace actually said that your gut is your first brain biologically, and I love using that now because it formed first. So everything ends and starts with it, right? Now we have that gut-brain axis, and it's almost like a highway, right? It's sending messages back and forth all day long, and it controls and influences everything: your mood, your stress response, inflammation, and insulin sensitivity. I love that you brought up rosacea and different issues because we've had so much success with the Feel Great system on other things beyond just type 2 diabetes, fatty liver. People do have skin improvements, rosacea gone, psoriasis gone, acne gone, and that is all because the balance has 7 different types of fiber in it, right? Now, when we have a damaged gut, it sends literally distress signals. And how do we damage our gut? If you could put up my first slide, we damage it in several different ways. Stress is a huge cause of all the issues in our body, right? Antibiotic use and in general medication use will impact your gut microbiome. And then we have the processed foods and the high carbohydrate, high sugar diet. Any carbs that you eat, bread, cookies, cakes, whatever it is, chips, they will turn into sugar, into glucose in your bloodstream, right? And that is chipping away at your gut microbiome, especially if we combine that with little to no dietary fiber. And as we know, 95% of Americans are fiber deficient, right? Well, when we're getting these signals that the gut is being damaged, it worsens our insulin resistance. And that leads to the vicious cycle of fatigue, cravings, weight gain, anxiety, mild depression, etc. However, when we heal the gut and we restore the balance inside it, you can calm down that anxiety and depression. You can reduce inflammation in your body and improve how your body handles the cravings for sugar and and carbohydrates, right? Now, when you have the leaky gut, like Dr. Grace said, you have the lipopolysaccharides, and they enter the bloodstream, and that causes the inflammation. So it's again this vicious cycle which disrupt your inflammation will disrupt the insulin signaling in your brain and your body, and therefore your brain will become leptin and insulin resistant. So we're dealing with insulin resistance where your cells are no longer responding to the insulin, but now you're having the leptin, your hunger hormone that's produced in your fat cells, unable to communicate to your brain that, hey, this person is full, they should stop eating. However, on the other hand, your ghrelin hormone is driving your hunger further up. That's how we end up with constant cravings for carbs and sugar, fatigue after meals, and we've all been there when we have something that, isn't that balanced and we need a nap afterwards, the brain fog, even mood swings. And then we start gaining the weight around the abdomen. And Dr. Grace mentioned that visceral fat, right? So you have the inflammation being caused by the gut. Then you're moving on to insulin and leptin resistance, and you're gaining the weight, which in turn creates more inflammation because that's what visceral fat does. So in short, your inflamed gut makes your brain think that you're in a panic, right? And that you're starving, even though you have plenty of stored energy. So what happens when we restore insulin sensitivity and we have a healthy gut, right? When that gut microbiome is balanced, it will produce short chain fatty acids, which will reduce the inflammation. It will improve your insulin sensitivity. It will enhance the fat metabolism. And I have something up my sleeve for that further. It will strengthen that gut barrier. So you cannot develop that leaky gut and have the toxic things in your bloodstream that shouldn't be there in the first place, right? And then when the gut microbiome is balanced, your brain can start receiving those fullness signals and the balanced hunger signals, right? Your leptin and ghrelin, they can be in sync and work properly. You can also drop your cortisol levels, and then you give your pancreas and your liver a break, right? Now, if you can go on to the next slide. When you start eating in a certain way that we teach in all of our lives and all of our resources and all of our private groups, you can naturally start eating in a calorie deficit or eating less without actually feeling deprived. It doesn't come with more restriction. It doesn't come with yo-yo dieting. You will start burning the fat instead of burning the sugar all the time, and you will start experiencing the stable energy and a better mood. And with that gut health, your skin will look better, your hair, your nails, everything just improves. People actually start to look younger because of a good gut microbiome. Now, again, we can't skip over the gut and not just mention for a second your mental health, right? The 90% of serotonin and 70% of dopamine is made in the gut. I know we're talking kind of about insulin resistance, but hey, when people don't feel good and when their moods are low, they're less likely to go exercise, to get out in the sun in the morning, to move their body because you're feeling tired, you have anxiety, you're feeling sluggish, the brain fog is not lifting ever, and therefore it's just exacerbating the issue. Okay, now when we balance that gut microbiome, our mood can increase, the cravings then decrease naturally, your sleep actually becomes deeper, so you're getting better sleep because we all say aim for 7 or 8 hours. but we have to look at how much of that is good quality sleep. If you're going through a stressful event, if you're having a lot of stress in your life, if you're eating too late to your bedtime, your sleep, you will not be reaching deep sleep. Right. And I mean, my watch tells me this. I monitor my sleep. So it will tell me actually, a lot of the times I do have stress in the middle of the night. That is not a good sign. So I'm doing strategies to improve that. Right. So in other words, when your gut health is good, your brain is good. And when your brain is good, your metabolism will follow with that. Right. So how do we reverse this insulin resistance through the gut healing? Well, we feed the fiber, we feed the microbiome, right? And we're staying away of what you see on the screen. The carbohydrates will give you a huge spike, so we want to limit those. We want to focus on the fiber lot from different sources. It's not listed on here because depending on what kind of fiber you have, that will depend on what kind of a sugar spike you have. But there's also the glycemic index and the glycemic load of foods. What do I mean? Right? Carrots are high in sugar, but they have a lot of fiber, and that fiber offsets the sugar load. So that's just one example. Protein is essential for muscle building, and then the healthy fat, we need it. It's good for us. We have to stay away from seed oils that are highly inflammatory. So we have to feed the microbiome, and we're doing the fiber-rich foods, right? And polyphenols that are in certain foods, but they're also in the Unimate from the Feel Great system. Right? Fermented foods. Then we're going to starve the bad bacteria by avoiding the refined carbohydrates, sugars, and seed oils, because the bad guys are striving on that. So if you eliminate those things, they're starting to panic and they're going to die off, right? Now, of course, we want to also support the gut lining repair, which Unicity's balance does in a great way. Managing stress and timing your meals with some fasting works wonderfully, right? Now, I mentioned polyphenols. Unimate is rich in polyphenols, and that is a natural plant compound that actually acts like a prebiotic, right? Because we have prebiotics and probiotics. And a lot of people only say probiotics, they're supplementing probiotics. But if you don't give your gut prebiotics, right? You're giving them the pre-food and then you're giving them the pro after. You need both, right? So Unimate naturally has that, and that acts like a prebiotic. They actually nourish the beneficial bacteria in your gut, which help you increase microbial diversity. It's going to strengthen that gut barrier and reduce the growth of harmful bacteria. Because we're feeding the good guys, we're going to starve off the bad guys, right? It's also going to reduce your gut inflammation because yerba mate has strong antioxidants and anti-inflammatory effects, right? It has a lot of chlorogenic acid that brings down inflammation in the body. And again, a lot of people report with Unimate, they have less aches and pains in their body and their joints. However, it actually lowers inflammation throughout your whole body. So a lot of people that started, they start feeling better, their face gets skinnier or slimmer looking, elongates. That's all from losing that inflammation, which also happens in your gut, which means less oxidative stress and less irritation on the intestinal lining. And that will support your digestion, and it's going to prevent the bloating with your meals, right? Now, this is especially important with people with insulin resistance or metabolic issues because high blood sugar and inflammation damage the gut barrier. Okay. So Unimate also mildly stimulates the bile production, which will help your body break down the dietary fats and absorb the fat-soluble vitamins A, D, E, and K. Dr. Grace talked about in her presentation about, deficiencies, etc. So in her functional medicine practice, she can look at exactly what you're deficient in, and then you supplement with this beautiful protocol that we talk about all the time that will actually help you reabsorb the nutrients from the foods that you're eating, okay? Now, it's also going to increase your bile flow, so you're going to have less of a sluggish digestion and less post-meal discomfort, right? Unimate also improves your dopamine and serotonin signaling, and because they're both produced in the gut, this is a win-win, right? So by improving your gut health, mood, and your motivation will naturally follow. And that's what I said. It's very hard to get out of the rut and get moving and work on that insulin sensitivity when you're not feeling good. And it does start in your gut, right? Now, we also have the balance, right? Because the balance will actually feed your good gut guys, your good gut microbiome. It has 7 different types of fibers in it, and it has the fibers that you'll never get from your food, okay? It has guar gum, gum arabic, locust bean, citrus pectin, oat fiber, maltodextrin, beta glucans, but it also has polysaccharides. And what polysaccharides help to do is restoring your brain sensitivity to leptin, okay? Now, what this means is that it's going to actually start that signaling. Leptin is a hormone that tells your body that you're full, right? So if we restore that sensitivity to leptin, your body will start getting the message, you are full, you're okay, you don't need to eat more, right? Now, when you have this, it's very thick. It's going to coat your entire digestive tract. It's going to feed all of the good gut guys that are fighting the bad gut guys. I always envision this like a cartoon in my head, right? And it's going to reduce your appetite and absorption of fat. Now, all of us that use this product, we know when you have the balance, it tastes amazing and it acts like an auto portion control. You're going to naturally eat less, and fiber actually diminishes the glucose spike. This one in particular will lower your glucose spike by 43%. It also lowers LDL, raises HDL, and lowers triglycerides at an envious rate. And this is why the Cleveland Clinic said that this is just as good as a statin medication. It beat 2 statin medications side by side comparison. So this is an excellent fiber that will, coat your gut microbiome, give it everything it needs. And then on top of that, what we recommend, of course, is eating a well-balanced diet, moving several times a week, because it all adds up and it all matters together, right? Now, the balance also has a vitamin and a mineral complex, so it's a nice addition. Vitamin B12, Dr. Grace was mentioning she was on metformin. People who go on metformin, it strips them of their vitamin B12. A lot of GPs don't actually recommend to their patients to take a supplement. And what ends up happening is that a lot of type 2 diabetics come to us and they say, well, I'm feeling tired, sluggish, depressed, but it's actually the low vitamin B12 causing that chronic fatigue and difficulty doing anything really and finding motivation, right? So it has a powerful B complex that will help break down your nutrients into energy. Okay. Now it has the zinc, it has a little bit of vitamin C and vitamin E as well. And those antioxidants are in there to prevent lipid LDL oxidation. So we're not getting that high LDL, the bad type of LDL. And of course, it also enhances effectiveness of the insulin. It reduces the blood glucose levels naturally. So it's just going to bring everything down. And the most impressive thing that people like about this is that this is a holistic version of Ozempic because it enhances your GLP-1 production by 40 to 70%. So GLP-1 is a hormone that's made in your gut, and it's made even easier in your gut if you support it. So this enhances it, but you're going to also, with the balance, keep your gut microbiome happy and healthy and thriving, right? So you need the variety. And that's how the Feel Great system really complements anything else that you might be trying to accomplish through somebody like Dr. Grace, because she can give you all of the analysis through the different tests that are available through functional medicine. But this will give you such a great kickstart that you'll be able to really dial everything in, and it's going to make it easy because diets fail a lot. It is very hard to stick to lifestyle modifications when we start because we see them as restriction. And what we have with the Feel Great system is actually less restriction. You can go to the next slide if you like. We have less restriction and more food freedom. And you have the prevention of insulin resistance causing any of these. And it is all related to insulin resistance. Not a lot of people are talking about this. Your doctor will not discuss this in their office because they don't have time to teach you the entire umbrella of insulin resistance. So if you have any of these on the outskirts of this picture, please note that these are reversible. We just have to tackle the root cause, and that's what Dr. Grace is here for. The root cause medicine. That's what functional medicine is all about. And we can tackle this and we can get you to better health. And I would highly recommend the Feel Great system. It's on the next slide. That's what it looks like. Dr. Grace now has a discount code that you guys can use to get your hands on this protocol that's literally changing lives around the globe. So yeah, with that being said, I'll hand it off back to Dr. Grace. She has some more information to share with you guys. Thank you so much, Dr. Grace, for having me on, and everybody for listening.
Thank you, Suzana, and really great presentation. I've learned a lot every time you talk, every time Dr. C talks, I learn a lot. There's always something to learn. That's why it's so important to keep the conversation going. So the two products, as you can see in the slide, Unimate and Balance. So usually you can have one Unimate in the morning and another one in the afternoon, and then have Balance with your main meal. Or if you're diabetic or pre-diabetic, you're better off having two balances in one with twice a day with your main meals and one Unimate. So I have a link to the shop, and Zarika will share the link. Please feel free to explore. You can buy the products online, or you can follow the link to our website and buy through our website. That's also fine, but your good health starts here. Now I open the conversation to the floor. If anyone has any questions, this is the time to ask. I'm going to close the slides so that we can have a more interactive face-to-face session. Okay, Zarika and Sal, weren't you on video? You're invited to join the conversation. How often can you have the Unimate? Suzana, I leave that to you.
So I usually have minimum 2 a day, and I sometimes have upwards of 4, depending on how busy my day is. It's just a matter of how much caffeine can you handle. It's tested for the upper limit of caffeine, but on average, I do 3 a day. I do one in the morning, one in the afternoon, and one kind of late in the afternoon.
Okay, good, thank you. And can children have this product as well?
Absolutely, yes. So we're careful with kids under about the age of 8 with the Unimate because of caffeine.
Yeah.
Now, if a said child is already having pop and eating unhealthily, the natural occurring caffeine in the tea itself will not do any harm, right? I mean, the pop they're drinking is worse than the caffeine content they'll get from Unimate. You could also give children under the age of 8 half of a Unimate in the morning, diluted further, half in the afternoon, diluted further, and I would cut that off at about 3 p.m. maximum, so it's not impacting sleep potentially. The little bumps on my neck are going away. Amazing, Jeannie. So the skin tags, what happens is they dry off and they fall off as you start to improve your insulin sensitivity. Back to the children, the fiber, I would recommend for every child to have. My 3-year-old takes the fiber, 6-year-old, and the 12-year-old uses the whole protocol. We know that we're all fiber deficient, so putting that fiber into their bodies, I mean, it's just food, it's plants, it has so many good things in it. And this is the type of fiber they will never get from food. So if you can get it in them at an early age, 1 in 3 teens in America right now is pre-diabetic. Those are huge numbers. So if we can start at an early age, it will help in the modern food environment.
Amazing, amazing. Good. Any more questions, inputs?
Chris, just a quick question for me. So, as you know, my DNA diet test showed that I should stay off coffee, right?
Yeah.
So, would these products still be suitable for me to take, or anybody who get the similar functional medicine test results saying that coffee intake should be stopped or reduced.
Yeah. So for anyone who is caffeine sensitive, you're allowed 1 cup of coffee a day. And also the amount of caffeine in Unimate is so little. It's like having a cup of tea. So it wouldn't affect your caffeine sensitivity.
And even the caffeine itself is different than what's found in coffee because yerba mate and Unimate is concentrated. It has theobromine, and theobromine makes the caffeine actually have a slower onset and longer duration. So, if coffee gives us a bump quick and then we crash, and that's how we end up having so many coffees in a day, right? Because we're always chasing energy. With Unimate, the theobromine slows down that caffeine. So even in my experience with my clients, they even the caffeine sensitive individuals can handle Unimate. Now, we always tell people who experience, let's say, jitters from coffee to ease into it, have half or do the whole thing and dilute it further. See how you do for a week.
Yeah, sounds good.
Sal has started noticing bumps on her clients, and it's so strange. One lady was complaining of headaches and small skin tags on her ears and cheeks, and Sal was like, "Oh, I know what's going on."
There the roadmap is. And actually, Sal, it's funny you mentioned that because I watched a video on Instagram yesterday of somebody who does lymphatic drainage, and she was doing lymphatic drainage on a person who has a heart, she's in heart failure, they told her. And she said, if you look at the body, there's always the roadmap. And she could tell there's bumps from the neck all the way to the ear. And you could tell that the aorta is like kind of swollen, and all of it was swollen in this region. So she came for the lymphatic drainage, and she said, this is the roadmap. And I just found that interesting that you brought that up today because it's kind of the similar thing that I saw yesterday.
We are
where
all
the channels.
interconnected.
It's funny that once you start doing things like this in metabolic health space, you notice a lot of the things, right? A lot of people who work with clients, massage therapists, doctors, nurses, estheticians, they start noticing their clients have that dark neck or armpits, the skin tags. It's the little signs that people don't look for, and we think of it as just normal sign of aging, but it really isn't.
Yeah.
Yeah.
Good to know. Right. I think we've hit the hour, and if there are no more questions, thank you everyone for attending. It's been very enlightening, and let's continue the conversation.